So hi, my name's Mia McKinstry. I'm one of the CA2s this year. Super excited to be here.
My name is Vanessa Loland, and I'm one of the Associate Program Directors, and I've been here for about 13 years now.
My name is Teresa Jiang, and I am a new CA3. I'm one of the UW Chief Residents for the VA and Seattle Children's.
My name's Matt Hallman, and for the past 8 years now, I've been the Residency Program Director.
My name's Quinlan. I'm one of the faculty at Seattle Children's Hospital, and I serve as the rotation director for the residents during their time there. And I also am a graduate of the UW program. I graduated in 2019 and was a chief resident in my final year.
So Casey, I wanted to ask you, what brought you to UW and what made you stay here?
So when I was looking for a residency program, I was looking for a big program with a really diverse training experience, and I think that the unique qualities of Harborview, the UW Montlake, the VA, and Seattle Children's was what really drew me into this program. As a trainee, it's sometimes difficult to be switching systems, but I think that you just learn so much more by challenging every small assumption and seeing how different systems are designed for the patients they take care of. And despite the challenge of that, I think that in the end it pays dividends and your learning is just exponentially more. And what's kept me here really has been the community. I feel like my colleagues in my division are like a family, and everybody loves coming to work, and the community that we have with our trainees and with our colleagues has been really amazing.
So Casey, do you feel like the UW anesthesia training program prepared you for your current career?
Oh, without a doubt, yeah. I think that you see so much as a trainee here that you learn not only how to do such a wide variety of things, but also how to tackle cases that you don't know how to do because they're so unusual that nobody's done them before.
I like what you were saying about the community. I didn't really think about it that much when I was choosing a residency program, but I found it really pleasant when I'm going to the different hospitals and I haven't been at one location for a long time, and then I return. People are like, "Oh, welcome back, Mia. Nice to see you. Where have you been?" And, "Oh, what have you been learning?" So it's actually like really nice. Everybody welcomes you back when you go back to the last place.
I think that's something we've been trying to work on for the past number of years, is try to build systems and a structure that supports finding your community, both within the department when you're at work, but also outside of work. Connect with other residents and build friendships beyond just your professional relationships. I don't know, Vanessa, you've been pretty active in a lot of those efforts to help connect residents with advisors and mentors.
Yeah, I do think that that's so important to build that basically connection between the faculty and the residents. I know that I've maintained a lot of the relationships that I've made throughout my position as advisor to a lot of these resident advisees, and it's just so, delightful and rewarding to see them as they progress through their training and they gain all the skills that are going to make them great anesthesiologists.
It's interesting, I think the residency program is large, and I didn't anticipate how much that might contribute to building community. I found as a resident that it meant that there were always people off on your day off. If you're post-call, somebody else's post-call from another rotation, you can find someone who has shared interests no matter what they are, like a ski buddy on a Tuesday or somebody to go to a show with. I remember there were a lot of people in my class who were interested in EDM, and it's not my interest, but on we had a group WhatsApp, and somebody would say, "Hey, does anybody want to go to," and it was like words that did not mean anything to me, and there was always somebody who said, "Yes, I want to go to that."
I hear about the groups of residents having hiking trips almost every weekend, so.
The current thing is pickleball, which was invented on Bainbridge Island, and we have a pickleball group chat, which I still haven't attended, but they pickle every couple of weeks in one of the parks in Cap Hill. So
yeah, they've converted a lot of the tennis courts here in Seattle to pickleball courts as well, so you have the option of doing both.
I think That's kind of just talking about Seattle and activities. One thing I really did consider when I was trying to figure out where I want to go to residency was the location. It was important for me to be in a city, but Seattle was very attractive because I could also go do other things. And so I've really enjoyed, I actually just went paddleboarding with one of my anesthesia buds this weekend, and I just did more of a city thing too. I had brunch with some of the new interns, and it's just really great to be able to enjoy Seattle, which is a beautiful city, as well as the outdoors, and enjoy them with my colleagues.
I was
my friends.
I was similarly motivated by that sort of thing. I felt like you work a lot in residency and there's an intensity to your training, and I wanted to have like a little extra push to be willing to take advantage of new opportunities and to get outside. And there's like endless possibilities for weekend trips and hiking and camping and more city urban activities as well.
We hear that a lot, right? That residents choose Seattle in large part because of the city and the surrounding and the activities that they can do, and they want to get outside and enjoy the nature and enjoy some of the city stuff. We also hear, and we're very much aware, that it's an expensive place to live, and it's definitely one of the more expensive cities to live in the U.S. Can you talk a little bit about how that's been, how it's been to afford living here? Do you actually have enough money in your pocket to be able to get out and do the things you want to do living here?
I think that, you know, you can, although as a whole Seattle is more of an expensive city, there's a broad range of where you can live and the cost of the places that you're living. So you can like make lifestyle choices that are giving you like more options for what you want to do with your excess money. So I live in a townhouse. I have 2 roommates, and it has a lot of space. We have a great backyard. I have a patio, and having that, I feel like I have a lot of excess money, like more than I spent like living by myself. So I get to use that doing the things that I want to do, like going out to restaurants or getting out of the city and like pursuing my hobbies. Like I just bought a new bike. I bought all this stuff for like climbing, and like I think that like you can prioritize things based on what your interests are.
Yeah, and Seattle's such a beautiful city in that you don't need to spend a lot of money to enjoy all of that Seattle has to offer.
Yeah, I agree with that. In terms of just cost of living, I think, yeah, nobody's gonna try to lie about it. It's expensive. But I agree with what Teresa was saying. I think you can just pick and choose where you're willing to spend some more money and where you're willing to spend a little less money. I do live by myself in an apartment, but I chose an older building. It's a walk-up. I don't have one of these like fancy roofs, which some other residents do. They pay a little more. They're in these new high-rise buildings, beautiful roofs, which are very nice for July 4th fireworks, by the way. So just make friends with somebody that has one. And yeah, and you can do it free things. So once you own a paddleboard, it's a one-time purchase. You can use that for all of the very many lakes all around. Hiking, if you have a car, is low cost. And then even if you don't want to go drive all the way out to hiking, I think things like Discovery Park in the actual city are really fun and really easy to access. There's a beautiful running path down on the Elliott Bay, kind of by the Sculpture Park Gardens, that I recently discovered and have been running at. So yeah, there's plenty of non-expensive things to do as well.
Yeah, we're really lucky that there's so much green space in the city and all these like bike trails, running trails, and things to do that are easily accessible. I think most people here do have a car, and the main benefit is like getting outside the city and accessing a lot of things outdoors. But even within the city, like I went on a bike ride around like all of Seattle, and like there's all these great trails for biking and like amenities that encourage that. So you really can like enjoy the city even without a car.
I think the university has tried to do some things in recent years to make it easier for employees of the university to afford to live here, including residents specifically, with provision of bus passes, some substantial improvements to compensation over the last couple of years, and trying to make it a more competitive place to live compared to other comparable cities.
Yeah, and I use that bus pass to get to work every day for both Harborview and UW. Children's I do drive to, and VA I do drive to, but I use that
Free
bus pass
parking
all the
at
time.
Children's.
Free parking at Children's, free parking at the VA.
Yeah.
Yeah.
Do you find it hard to have to go to different sites?
I think at first, when you've been away, it can take a day or so to remember how everything works again. But I really love having the various sites. I think that when you eventually are going to progress to being a physician elsewhere, you are expected to have a level of competency. And so if you were at the same place forever during residency, and then the first time you ever experienced something new was in your new job, I think that might be a little more daunting. Where now I've done it at 4 different hospitals, so I feel that
You're fully prepared.
do it anywhere.
Yeah.
You know, Casey, you've got the perspective of joining a practice after doing your training here with a bunch of people who trained elsewhere and came into your same practice. As you look around at what they're comfortable with, what you feel comfortable with, you have those conversations with them, is there anything that you feel like you were left wanting after coming through here, where you felt like, man, maybe some of these places are offering things that we don't offer, or conversely, like you got some additional experiences that maybe other places aren't necessarily providing?
I mean, I think the first thing that comes to mind in terms of the experience we have is like the comfort that residents that graduate from this program have managing a massive transfusion protocol. Like by the end of your time at Harborview, you can run a massive transfusion protocol with hundreds of units of product, like essentially in your sleep, very comfortably without an attending. I think universally that's true of graduates of this program, and that stays with you. Like the principles, your ability to assess volume status and to kind of switch into that mode is life-saving, even if you don't work in a trauma setting, if you're dealing with unanticipated hemorrhage or significant blood loss. So without a doubt, I would say that's easily one of the skill sets that is honed very strongly through this training program.
I think that in choosing a residency program, I really did like the fact that we had what you kind of think of as our county hospital, and then the university hospital. Where I went to med school, we had a similar situation, and I thought it provides you with a large breadth of cases. Everybody kept talking about, we serve the entire WAMI region. We cover so many things you can't even imagine. And oh my gosh, they were correct. I couldn't even imagine. I have seen so many things, and I text my friends, and they're just like, what is happening in Washington? And I'm like, well, it's not just Washington. It's we get all these crazy things. But yeah, it's incredible. And I think between the very significant traumas that you can see at Harborview, and then the very complex medical cases you see at the university, including regular liver transplants and other types of transplants, and just rare diseases, I don't really think I'm missing anything. And I'm only a CA2, so I'm sure I'll keep continuing to see much, much more.
I think it's even after my training that I really gained perspective on some of what you're describing too, which is also just how the system that you work in is set up to take care of the patients that they serve. And you know, at Harborview, you'll hear about patients before they arrive. You'll pick them up in the ED and get them into the operating room in minutes. The ORs are set and ready to go. And that means you can save lives that you wouldn't save in any of these other systems, because we just aren't set up to do that. And there's cost and benefit to every way that a system is designed. Typically at Children's, things do not move as fast as they do at Harborview, but there are different checks and balances, and it's designed for the patients that we care for. And so I think really, as a trainee in this program going through these sites, you gain an appreciation for what the advantages or disadvantages to each of that are, and also just how to work within your system to take care of the patients that come.
Yeah, thinking about that, the patients that we care for from the perspective as a faculty member at Harborview, I think one of the things that I really enjoy about the job there, and that I think trainees and everybody else gets to experience as well, is that we get this really cool, diverse patient population there, and you learn how to take care of this really diverse patient population. You know, there's a lot of focus on disparities and trying to minimize disparities in the healthcare that we provide these days, and it's nice to be part of a system that that does focus on that, and it does more than just pay it lip service at a place like Harborview. You actually really get a chance to make a difference with thoughtful care.
Strong service component, even in the kind of overall culture at Harborview, really strong service component among all the physicians, nurses, supporting staff. Yeah.
Everybody shares the same goal and the same vision of taking care of patients, and so it's more of working as a team together. That's what I get when I'm working with a resident.
There's been a lot of, there's been a lot of focus on equity and diversity on a national, societal level in the past number of years, and I'm struck by the fact that I'm sitting at a table with 4 women, and I wonder if you guys could talk a little bit about your experience, if you don't mind, your experience being a woman in this department, in this hospital system, in this school of medicine, and what that's been like, and whether or not you felt supported and felt like you've been able to find mentorship and people who can help you navigate your path the way you want to do it.
I can say that I love being here. I feel valued as a woman, as part of the UW anesthesia faculty, and I guess I just want to pay it forward to other residents, and just so that everybody feels as valued as I have in the past.
It definitely struck my mind when I was choosing anesthesiology in the first place as a career. I was thinking, oh wow, this is actually like a male-dominated field. A lot of programs, just because of that fact, have maybe more men than women, even if they try to make it even. But I have to say, even though I am pretty sure our residency class, I think, has more men, I don't actually notice it at all on an everyday level. I think I have so many female friends in the residency program, as well as excellent female attendings that I work with on a daily basis, and I see a lot of role models in that way. But the men I work with too, I think, are very interested in supporting every resident, no matter who you are, and making sure that you're comfortable and your needs are met and you're getting an education. So I haven't really felt in any way bad about it. Yeah.
I think that throughout, as I've developed as a resident, gone through different clinical sites and worked with multiple attendings, I feel lucky that I've found some attendings who have reached out to me and taken an interest in helping me to figure out what I want to do with my career, and in encouraging me to pursue things that I'm interested in. So it's really been although we're in a big program, I feel like there's been people who have taken an interest and encouraged me to grow as a resident and as an anesthesiologist, which has been one of the reasons that I decided to run for chief and got elected as chief, was that one of my mentors at Children's suggested that this was an opportunity that I should take. So I feel like people are interested in pushing you and helping you to find your full potential.
That's the benefit of having such a large faculty pool too, is you can find your kindred spirits amongst a large group of people, and so there is a faculty advisor and a mentor for every resident.
Yeah. And even within the residency, we've really started working on having residency mentorship between the different residency classes with the FAMs, where there's residents assigned from each year, so that you have someone in every year to have as your point person to talk to for any of the little questions that come up, and to try to create more community within the classes.
And that's something you guys really organize and run as chief residents. That's not really an official departmental program, but it's certainly something we support and encourage and like to see you doing.
Yeah. So Maria, our academic chief resident, read every single resident's bio, paired them based on her understanding of their personalities, and awesome. She was really agonizing over her choices of who to put in each family. Yeah. Let's see. I've been a resident here for the past like 3 years, and over that time, I wanted to like have us talk about what changes we've seen in the program. I feel like there's been a lot of changes in the intern year, and I didn't experience it personally, so I don't have as much to say about it.
Yeah, I think, you know, on the program level, we've been focused on a number of things trying to improve the program. Certainly trying to minimize or keep, I should rephrase that, I think keeping the hours that you're working as humane as we possibly can has been a big focus of the program, and that's resulted in largely the elimination of any kind of 24-hour calls, really moving all nighttime coverage to kind of a float system. The addition of a lot of mid-level or advanced practice provider support so that the service component of things isn't 100% dependent always on having residents there to staff all the rotations all the time. That's definitely been something that we've been focusing on, and I think we've seen a lot of movement on in the last year or two. And when we objectively look at that, it's nice to see that residents are reporting a lot more satisfaction with the duty hours that they're working, and we've seen that continuous progressive trend over the past 3 or 4 years, and that's looking much nicer now.
I think when I was an intern, my favorite rotations were ones that were within the department, because you do so many things that are like to build a baseline breadth of experience. And then it was fun to get into rotations like even on pain service, where you're working with people who are your seniors who are in the same field as you, and to get a taste of what it's like to be a part of the be in the ORs and be more involved in your own program. So I think that like there were some changes with having more elective time for point of care ultrasound training within the department, and I saw some of these interns when I was in the OR like going through scanning, and they were all really excited to be like getting more involved.
Yeah, I mean, when I think about the point of care ultrasound curriculum that the residents are having now, I'm like very jealous that we didn't have that as trainees. And I will say, even from the faculty side, part of putting that program together has been training more faculty in POCUS, and I think that's been like an incredibly rewarding endeavor. I've definitely benefited from it, with the understanding that in order for our trainees to gain expertise, they have to have their hands on the probe all the time, and if we're going to teach it, we all have to have that skill set too. So having a cohort of faculty having gone through more formalized training in TTE and lung ultrasound and gastric ultrasound has been an awesome experience as a faculty member, and has been a very cool experience, I think, for the residents as well, to get to do much more hands-on ultrasound in the operating rooms at Children's is where I see it.
Yeah, and that's been possible largely because the chair and the department have agreed to provide the support for faculty to get that additional training, giving them non-clinical time, providing a faculty person to actually lead those efforts, and Dr. Nickervon, and really supporting that faculty development so that residents can continue to benefit as well.
I think that ultrasound practice is actually a really good example of how the faculty themselves are very invested in our education, because those sessions that we go to, as long as we're not called into duty from our Jeopardy that intern year, those faculty members are purely on a volunteer basis, and I had a great experience. There's always somebody available for mine, and they spent full 4 hours with me going around the hospital scanning different patients. I did have Dr. Nickervon, I had Dr. Pauline. It was really great, and they're just doing that in their own free time, and they're very busy people, so.
I think traditionally when we think about ultrasound in anesthesia, we think about it in the context of regional anesthesia. That's where it's been most prevalent for a lot of years. And the regional experience is another place that I would point to as a place where we've really made a lot of strides in the last couple of years, especially for the CA3 rotation, where folks are routinely getting more than 50 blocks a week with really pretty phenomenal teaching, hands-on teaching, and a lot of instruction.
You were kind of asking about changes that have been made, and I think a really good example that got enacted and I got to experience was the pain service. I was like almost scared of the pain service because of all the things I had heard about how it was just going to be, you're going to be called all day, every day, all night for everybody's pain. But when these changes that you guys took people's feedback very seriously and enacted some changes, I had no concerns about that rotation. Definitely nowhere near close to any duty hour violations, and it was just very reasonable rotation. I got to really benefit from people such as Teresa. I think it didn't quite get to experience that change.
It was challenging.
Once upon a time. Definitely, definitely a different beast now.
We do take the resident feedback very seriously and do everything within our power to make changes that makes it a program that you really want to be a part of.
Mm-hmm. One thing that I've really enjoyed over the past couple of years, or over the past year, is that since COVID, restrictions were more relaxed at UW, the ability to gather with our co-residents and to do more teaching in person and to have a switch from like an evening session where you're on your way home, you're listening to Zoom, and you can't quite like be invested or pay as much attention to like a full day dedicated didactics where that's your only responsibility and you're clear from clinical duty, was really like a huge change. And it was also like nice to spend more time with your co-residents and to like build more community within your own class.
I love the all-day didactics, and I definitely agree because I did experience some of the evening didactics, which sometimes still happen as the early CA ones when you're really trying to, like the CA1 boot camp. But when we moved over to the all-day ones, I found it so much easier to really be 100% focused on the lectures. I am a person that likes to go in person, but for individuals maybe who have kids or just other things where it makes it a little harder for them, and they have the option of maybe taking care of their kid at home and also going to lecture, I think it's great that you have both options. And the good thing about going in person is they provide breakfast, they provide lunch. So.
And you get to see your friends.
Yeah.
Socializing. Yeah, that was the goal with making that change.
Well, guys, thanks so much for taking the time to chat about the program a little bit here. I think we're about out of time, but appreciate